Today I want to talk a little bit about the mechanisms underlying the symptoms of long COVID. So when I originally started looking at this, I started looking at the symptoms, and I wanted to take each symptom and then really try and drill down to the exact molecular mechanisms and the biological pathways that were causing each symptom in long COVID. So I've been looking at this for a little while now, and I'm seeing that it's going to be really difficult to actually try and nail down specific mechanisms to specific symptoms in isolation. And the main reason is because a lot of these molecular mechanisms and the biological pathways that are affected in long COVID are all interrelated, and they're all communicating with each other. And it's very difficult to try and just treat anything in isolation. So what I've decided I'm going to do instead is I'm going to try to kind of figure out which are the molecular mechanisms that are the primary causes, the primary events that happen because someone comes down with long COVID, and then what are secondary effects, right? So if we can differentiate between a secondary effect that happens downstream and the original primary events that are kind of a direct result of getting infected with COVID and then having this re-emerging long COVID disease kind of affect people, then that gives us some direction to want to be able to look at treating the primary events as a way of resolving those and the secondary events at the same time. If you're only looking at the secondary events, then if you just treat those, they're always going to come back if you withdraw the treatment, or if you don't treat the primary event, they'll just never go away, right? So, and in my mind, I kind of liken this to, in oncology research, we talk about driver mutations and passenger mutations. Driver mutations are like the primary mutations that happen that really push cells over into being tumors and to really drive tumor growth, versus what we call passenger mutations that happen. They make things worse, but they're kind of along for the ride, right? So I'm going to be focusing on kind of the primary events that seem to happen in long COVID to see what's driving the disease and really making people sick. And then hopefully those are the ones that can get addressed first. So that's what I'm working on right now. If you're interested in that, leave me a comment below. Check out my profile. Give me a follow if you want to stay updated on the research, and more coming later this week.